Hi guys, welcome to your prosthodontic lecture. Today we speak about basic implantology. Learning outcomes in this lecture, we would learn about implants. We would also know about different types of implants, so classify the implants and also the different components or the parts of an implant. Describe and recognize the importance of osseous integration. What is a dental implant? An artificial dental root that is surgically inserted into the jawbone and that can be used by the dentist as platform for prosthesis. So basically, an implant is a screw type which is placed inside the implant cavity, which is created by drilling the bone inside. Once you place this, you place an abutment or you screw the abutment to the implant, and then you place or fix the prosthesis onto the abutment. So this is a dental implant. Dental implant components. So we have the implant body or the fixture. As you see, this is the one which goes completely inside the bone. So in the right side figure, you see the bottommost, you have the implant body or the fixture, which is placed inside the implant cavity created in the bone. After that, you will seal the implant or you close the implant, which is the hollow surface in between. You close it with a first stage cover screw. Once you have done that, you place or you suture the flaps over it. After that, after some days, you recall the patient, you re-incise at the site of implant placement, and then you place the second stage per mucosal extension. This is nothing but the healing abutment where the mucosa heals or forms a collar around these abutment. Then you have the abutment, which is basically placed onto the implant for the placement of prosthesis. So the abutment is basically three types. We have the screw, cement, or the attachment type. The screw type is where the prosthesis is screwed onto the abutment. Cement is where it is cemented, and the attachment is basically the ball and socket one, where the overdentures are placed on this ball and socket. You have transfer coping, which is used during impressions, analog also during impressions, coping, and coping of prosthesis screw, which is used to bind the prosthesis onto the implant. Osseointegration, a direct structural and functional connection between bone and the surface of the load carrying implant. So basically, osseointegration is nothing but a binding between the implant and the bone. So how does this take place? What happens is when you do a drilling into the bone, you are actually injuring the bone. So when you're preparing a cavity inside the bone for the placement of the implant, you are actually injuring the bone. So the bone has to heal. So there is a wound healing process which takes place. So once you place the implant inside the cavity, the healing takes place where the bone binds to the implant. That is, there is formation of the bone around the implant. So this binds and hugs the implant and places the implant in that specific space. So this formation of bone and attachment to the implant is nothing but osseointegration. Okay, so osseointegration is very important. This is because the prognosis of the implant determines by the osseointegration of the implant. Classification of dental implants. There are different types of implants based on the anchorage, blade form, and the texture. The Based on the type of anchorage, you have the submucosal, subperiosteal, transosteal, and endoosteal. Blade form, we have the conventional and vented. Texture, we have surface with pure titanium, acid etch, porous, and hydroxy coated. In this slide, you see the different types of implants. You have the endosteal, the most common one, which is basically placed inside the bone. You have the subperiosteal, which is placed on the alveolar crust or the alveolar ridge, and you have the plug which projects out, which is the implant which is used for placement of prosthesis. Then you have the transosteal. This is basically the bone or the implant or the post is drilled completely through the bone and it comes out from the bottom where a metal plate joins these posts together. Then you have the blade, whereas the implant looks like a blade type which is placed inside the bone. And then vented, the same blade type have vents inside them, basically for better fusion with the bone. You have the surface coated ones, you have titanium which looks like that, then you have the acid etched porous beaded implant and also the hydroxyapatite. These are surface texture coated or they are The surface texture is manipulated. This is basically for better healing of the bone and also binding of the bone to the implant. Acid etch or hydroxyapatite, a porous beaded, basically have kinds of pores and ditches or micropores inside them where the bone can enter into these micropores and bind to the implant. Teeth versus implant. So what is the difference between a teeth and implant? Definitely an implant lacks PDL, periodontal ligament. Implant cannot intrude or migrate, meaning to say that they cannot grow, meaning to say that it is contraindicated in growing individuals. That means the individual who is still in his growth, placing of implant will not grow along with the bone. So once the implant is placed, it may hinder with eruption of teeth or also any other anatomical structures, hence contraindicated in younger children. Then you have proprioception. So basically there is no proprioception with implants because lack of PDL, and also overload and parafunctional habits. It can cause fractures and microstrain for the implant. Indications: where can you place the implants? Where there is dental aesthetics necessity, where there is function necessity like chewing and speech, space maintenance and occlusal stability. Orthodontic anchorage: where there is movement of anterior teeth necessary, you place an implant at the posterior, that is usually in the molar areas, which helps as an anchor. Then for convenience and comfort and also bone preservation, so placement of implant reduces resorption of bone, helping in maintaining the bone. So hence implant is a better choice of treatment plan when compared to fixed processes or dentures. Material used for implants: you have the commercial pure titanium alloys which may be coated with certain textures, and also we have the ceramic materials. How long does an implant last? 90% last more than 15 years. But implants can last even further, basically about 20 to 50 years. So implant is the best choice of prosthesis replacement when compared to fixed prosthesis or compared to your bridges or your dentures. Risk factors that affect the management. Basically, when you see patients who are edentulous, mostly are elderly. Very rarely you see younger patients who have become edentulous. So those patients who are elderly definitely have certain problems or systemic problems. Hence, determining the systemic problem before the placement of implant is very essential, as may lead to if not, it may lead to poor prognosis. So systemic diseases: you have uncontrolled diabetes, which is one of the most common diseases in the entire world, and it is contraindicated or it is a risk factor in placement of implants. Immunosuppression or certain medications like bisphosphonate. Local: basically radiotherapy, smoking, poor bone quality and density, periodontal disease, occlusal trauma, parafunctional habits, and bruxism. So periapical lesions in the adjacent teeth may also infect the implant and hence may cause poor prognosis. Smile line: unrealistic patients' expectations and poor. Soft tissue biotypes are also risk factors for implant cases. Contraindications for implant treatment: so radiotherapy, pathology or malignancies, periodontal diseases, drug and alcohol use, psychiatric disorders, recent myocardial infarctions or cerebrovascular accidents or valvular prosthesis surgery, intravenous bisphosphonates, immunosuppressions, and inability to maintain high levels of plaque control. Dental implants are contraindicated. Options of treatment for tooth loss: as you know, we have dentures, fixed processes or bridges, conventional or cantilevers or adhesives, and you also have implant treatment. Out of these three, implant is the best choice of treatment but cannot be given to all patients. Treatment planning: yes, as you plan any other treatment, you also have a planning for your dental implants. That is basically the chief complaint, which is very important. You have to take dental and social histories to recognize whether they are regular attendees to the dental to a dentist, or they are smokers or alcohol consumption consumers. Then you might have to think twice. Medical history to know the systemic diseases or any other condition problems which may contraindicate in the placement of implants. Extraoral examination, intraoral examination, full periodontal charting to know their periodontal health. Diagnostic imaging is very important. Photography, diagnosis and treatment presentation, where we can present it to the patient to make the patient understand. Written treatment plan and cost estimate should always be given to the patient so that they know how much it costs and what exact procedures or what are the periodic recalls you will actually call the patient back for. Patient education and informed consent is necessary, and communication with other members of the team and referring practitioners also is necessary if any need be. Prerequisites: before you start your treatment, you want to take certain things into consideration to design and plan your treatment or to do your treatment. A good quality clinical photography is very important. 2 sets of study casts, FACEPO and occlusal records for your articulation of your casts, and a realistic tooth waxer basically to show the patient how it looks like, and also to do a surgical stunt for your placement of implant, which determines the angulation and the depth. Construction of a radiographic stent based on the tooth setup. This is basically when you take a OPG or a CT scan, you will understand where your implants are going to be placed and in what angulation and to what depth. You can take a sectional if you're doing 1 or 2 implants, or a full arch CBCT. This is basically tells you the density of the bone, the angulation, the width, mesiodistal and the buccolingual width which is required for placement of implant. Analysis with suitable planning software is a necessity so that you know how you are going to go about with the treatment. And this will allow the relationship between the final desired tooth position and the existing underlying bone to be visualized in 3 dimension. A decision as to whether sufficient bone exists and whether more advanced surgical procedures will be required to provide bone volume. So before you start evaluating whether you can place an implant, a CBCT scan is necessary because it will give you how much of available bone is there, or the bone volume. So if you need any further surgical procedures or placement of extra bone required, then you might have to do this prior to your treatment. Where applicable, occasionally the manufacturer of surgical guide manufacture from this plan. This is how the CBCT looks like, giving you the angulations, the depth and the width, and also the occlusal view to know where exactly the implant can be placed. So some of the techniques which are used in impression, basically you have is direct impression technique, which is the open tray, and then indirect impression technique, which is the closed tray. So talking about the open tray, that is the direct impression technique. In this you have is once the implant is placed and you're going to place the abutment for impressions. So you screw the abutment onto the implants, and then you have a special tray where the special tray has a window where these abutments can come out of the special tray. So this is basically done where the impressions cannot, or where the impressions cannot reach up to the sulcus, or where your abutments are quite long. So once you have screwed them on, you have the open window special tray which is fabricated. You squirt the impression material, which is usually a dual technique, or a monophase impression material can be used, and you take the impression of the arch. As you see in the third image, you see the abutments which are coming out of the impression tray or through the window. Once you have done that, do not remove the impression. Wait for the impression to set, and then you loosen the abutments with the help of the screwdriver. So you remove it. You completely remove the abutment from the implant, but do not remove the impression from the mouth. Once you have done that, then you remove, once the abutment is completely loosened or disengaged from the implant, then you remove the impressions. So what happens is the abutment comes along with the impression tray seated inside the impression material. Once you have done this, take the analog. This analog is a part which goes into the dental cast. That means you would get to know as you go on. So you place the analog, or you screw the analog onto the abutment and send it to the dental technician for the impression to be poured. This is your open tray technique. Now is your closed tray technique. In this, you do not have to make any kind of open window for the impression tray, that is your custom tray. What you do is you place your abutment on, or screw your abutment or the implant, and just go about taking an impression how you do for prosthesis or your bridge cases. Once you have done that, you take out the impression, you unscrew the abutment, and then you attach the abutment to the analog with the help of a screw outside the patient mouth. Once you have done that, you hold the implant in the from the analog side and place the abutment inside the impression where it is supposed to be seated in. Once you have placed it inside, you send it to the dental technician for it to be poured. So this is how your analog and your abutment look like. The upper portion is your abutment, the lower one is your analog. So once you have screwed it, you place it back into the impression as you see in the image on the lower left. You place it back so the analog protrudes out of the impression. So once it is protrude, you ask the technician to pour the cast. So this analog gets seated inside the cast, and then you can remove the impression out where the abutment extends out of the dental cast as you see in the lower left image. So this is your lecture for dental implants or basic implants. Any questions, please feel free to put them on Google Classroom. I will be very happy to answer them. And also I would upload a couple of videos to understand the open impression or open impression technique and the closed impression technique. Thank you. Have a wonderful day.